Our next section is normal pregnancy complaints, and we've covered a number of these already, but let's just see if we can summarize these briefly. Backache is very common, particularly in the third trimester, because of the lumbar lordosis as the woman adjusts to the heavy uterus which is in front of her. And men will never know what women have to go through in carrying a large uterus. Correct posture is going to be helpful, but somewhat this is just a matter of time. Bleeding gums can occur with epulis, which is gingival hypertrophy during pregnancy. It's very common because of the increase in blood flow by estrogen. And there's really not a whole lot you can do about this. Breast enlargement is very common. We talked about this before. Make sure you have a support bra, and basically there's not a whole lot that you can do for this as well. Carpal tunnel syndrome can develop in the third trimester as you start to have compression of the median nerve as it goes through the carpal tunnel. Wrist splints can be helpful. Your orthopedist will not want to operate on a patient who's pregnant. Conservative management with a wrist splint, and typically that will resolve after delivery. Complexion changes, we talked about the chloasma, the pigmentation which occurs. Some people think that good nutrition can help prevent that. I think a lot of that is probably inherited. Dizziness and fainting can occur because of the normal decrease in systolic and diastolic blood pressure as a result of the dilation of the vessels from the smooth muscle relaxing effect of progesterone. Particularly women who have low blood pressure to begin with, if they rapidly get up from a sitting or a laying down posture, they can get decreased blood flow to the brain. So avoid rapid postural changes. Fatigue is just part of the package deal that many women experience with pregnancy. Interestingly, some women say, I never felt better than when I was pregnant. But I certainly can't say that that's the experience for all women. Fluid retention, this is particularly in the last part of the pregnancy. As you have a decrease in albumin, you're going to have then a loss of fluid from the blood vessels into the interstitium. And so fluid retention, particularly in the lower part of the body, is very common. Elevate the legs and support hose. Hair and nails. Now this is interesting. There is a decrease in the normal loss of hair which occurs during pregnancy. And postpartum, that hair which should have fallen out before now starts falling out, and many women will report, when I comb my hair, it seems like I'm losing a lot of hair. And she may very well be. That should not occur in clumps. She should not get bald from this. But loss of hair is very common. Headaches can occur particularly because of muscle contraction, tension headaches. These are very common in pregnancy. Ice packs. Some people say high energy snacks can be helpful. Leg cramps can occur in pregnancy. Calcium supplementation, leg stretching exercises can be helpful. Morning sickness, ubiquitous, as we talked about. Small meals, carbohydrates can be helpful. May need to have some pharmacological agents to help if it is severe. Nosebleeds, because of the increase in estrogen, you have dilation of the blood vessels, particularly in the nose, and you can get nosebleeds. Avoid nasal sprays because they can be absorbed, and we'd like to minimize the amount of fetal exposure. Stretch marks, my suspicion, is probably more of a genetic contribution. You can buy snake oil, or you can buy queen bee jelly, or you can buy aloe. Lots of people would love to sell you their special potion. Does it work? No, I doubt it. Stress incontinence, very common in the last part of pregnancy because of the pressure on the bladder. Kegel exercises to help to strengthen the pelvic diaphragm may be helpful. Again, after pregnancy, this usually will get better. Varicose veins, remember there is an increase in venous pressure particularly in the femoral system and the lower part of the body. And this can be in a patient who has genetic predisposition, very severe, and she may have to actually be in a wheelchair. But for most patients, avoid standing for long periods of time, avoid sitting for long periods of time, particularly where the knees are somewhat flexed, and support hose may also be helpful. And that's the end of pregnancy complaints, normal pregnancy complaints.